Okay, before we continue scrolling down, we can see that there is an enlargement right here before the thoracic duct starts. This enlargement is called the cisterna achilli, as you can see here, and that's composed by these three branches, the right lumbar trunk, left lumbar trunk, and intestinal trunk. When they get together, they form the cisterna achilli. Okay, so let's keep scrolling down. And right here we have, as we said, the right lymphatic duct is for the right side, just 1/4, remember that, and the thoracic duct is going to be for the 3/4 of the rest of the body. Okay, so we keep scrolling down, flow of the lymph. We already talked about this regarding that the flow of the lymph follows the same pattern as the venous return. It needs the help from the abdominal pressure as well as the skeletal pressure that happens at the level of the legs. Okay, I already talked about it. So the lymphatic cells. So we have cells in the lymphatic system, obviously, and they are mainly involved with the immunity of your body. We have here natural killers. This is a type of lymphocyte T responsible for destroying cells that may be infected with viruses or cancer cells, for example. T lymphocytes, they are going to be lymphocytes that are going to be created in the bone marrow, but then they will go to the thymus in order to get mature. B lymphocytes are also produced in the bone marrow, and they will be mainly in charge of producing antibodies. Macrophages are phagocytic cells. When the monocytes come out of the bloodstream, they will turn into macrophages. We keep scrolling down. We have dendritic cells. Dendritic cells belong to the APCs. APC stands for antigen presenting cell. These are going to be important cells that we will talk about when we specifically talk about immunity. They have a very important job in there regarding immunity. Reticular cells, same thing. Those are also antigen presenting cells are found in other areas of the body, in particular connective tissue frameworks, such as for example the one found in some of the lymphatic organs. So let's keep going. We have then lymphatic tissues. Again, this is the lymphatic system. Systems are composed of organs. Organs are composed of tissues, and tissues are composed of cells, and all these different elements are found in this particular system. So we talk about some cells. Now we are going to talk about lymphatic tissues. So lymphatic tissues, basically, they are just set of cells that are going to group together in a diffuse way. As you can see here, diffuse lymphatic tissue, or in a more organized way, lymphatic nodules. Lymphatic tissue, in the case that is diffuse, is the one that you're going to find in organs where you cannot have other organs, obviously, because based on the organization of the body, you cannot have an organ within an organ. Therefore, if you have, for example, the intestines, you cannot have an organ of the lymphatic system to protect the intestines. Therefore, the only thing that you can put in there is going to be tissues, which are just group of cells. So this group of cells, again, found, for example, in that, as I said in here, for example, digestive system, right? You are going to find them also in the urinary, respiratory, and those set of cells are going to be called mucosa-associated lymphatic tissue, or MALT. So tissues, they are going to be loose, right, and diffuse, we can call it like that, and they are basically because these tissues are going to be found within other organs, because again, based on the body organization, you cannot have organs within organs, so the only thing you can do is just put a tissue within an organ. That's what's going to happen in here, and these tissues are going to be called mucosa-associated lymphatic tissue. Lymphatic nodules are more specific, they are more set, right? And they are going to be found, for example, in lymph nodes. Okay. You also find them more associated in the small intestine, and they are called Peyer's patches. Okay, so therefore nodules, or big groups, let's put it that way. If you find them in intestines, they're going to be called Peyer's patches. Other than that, most of them, these lymphatic nodules, you're going to find them at the level of the lymph nodes. And let's take a look at that. If we scroll down right here to where the lymph nodes are, you can see right here, it says lymphatic nodule, right here, lymphatic nodules. Okay, so then the lymphatic nodules obviously are going to be very important because they are groups of lymphocytes that are going to be located in this area. Okay, lymphocytes as well as other white blood cells in there. So if we scroll back up, so we said that we have lymphatic tissues, diffuse. They're going to be usually located in the digestive and respiratory system, for example, and they are going to be called MALT, mucosa-associated lymphatic tissue. If they are more dense, then they are going to be called lymphatic nodules, and you can find them, as I said, and I show you in the lymph nodes, or if you find them just in the level at the level of the intestines, you're going to call them Peyer's patches. The figure right here is showing you the intestines right here. Right? This is the wall intestines. This is the tube of the intestine. The clear area here is where the food would be. Right? And right here you have a lymphatic nodule. In this case, this is going to be the Peyer's patches. Okay, so if we keep scrolling down, then we talk about the lymphatic organs. So in this case, we have lymphatic organs. The first one that we're going to have in here is going to be the bone marrow. Obviously, the bone marrow is going to be here because the bone marrow is where the white blood cells are going to be created, right? Therefore, the lymphocytes, for example, will come out, and they're going to occupy the nodules that we just saw a little bit ago. So if we keep scrolling down, you can see there the bone marrow, obviously, because that's where we are going to produce the white blood cells. Okay, the next one is the thymus. The thymus is a very important organ because in here is where the lymphocytes T will go to mature, and you can relate T with T. So the lymphocytes come out of the bone marrow, and you're going to have two kinds of lymphocytes, basically. Lymphocytes T and the lymphocytes B. The lymphocytes T go to the thymus in order to mature. In other words, maturing means in order to learn how to fight infections. Okay, so right here, you see that the thymus is going to be the area where the lymphocytes T are going to mature. Most of the lymphocytes T are going to be capacitated, or they're going to learn how to fight infections. But if they are not able to recognize antigens, for example, then they are going to be discarded. They are not going to be used. So not all the lymphocytes T will come out of the thymus ready to fight an infection. So the thymus, if you look at it using the microscope, you will see that it has different areas. As you can see here, the thymus is right here, that is being cut in half. Right here, you have the specific view using the microscope, and you can see right here that it's going to have a cortex on the outside and a medulla in the middle. You're going to have trabecular, which are separations in between the cortex that you have between two different areas. Okay, so if we look at the cells with detail, you're going to see, as you can see here, obviously T lymphocytes. The thymus is going to also show this very characteristic structure, which is called the thymic corpuscle. The thymus, in order to attract and in order to allow the lymphocytes T to mature, they are going to release hormones called, for example, thymosin. The thymus occupies the space that is on top of the immediately on top of the heart, and is big in when we are young, maybe until 6 or 7 years old. After that time, it starts degenerating, and now at our age is very, very, very small, and it has no particular function. So if we keep scrolling down, now we have the lymph nodes. Lymph nodes, we have quite a few, multiple different areas of the body, and they are found across the pathway of the lymphatic vessels. We have approximately 400 to 450 different lymph nodes in our whole body. They are basically work as an area of activation for lymphocytes T and lymphocytes B, and you're going to find them in multiple areas, as I was saying. Like, for example, you have in here this figure where it's showing you the large intestine. You can see here the path of the lymph nodes, the path of the lymphatic vessels, and you can see lymph nodes here, 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 and they're located in multiple areas. So if you keep scrolling down, right here, for example, you have lymph nodes in the inguinal area, very important. And then if we cut a lymph node, you can see here the characteristic that you're going to find in there. Again, they're going to have a cortex, which is the outer area right here, and they're going to have a medulla, which is the middle area. In the outer area where the cortex is, you're going to have the lymph nodules, where you have the germinal centers. The germinal centers are the areas where the lymphocytes B, for example, are going to learn, they're going to mature, and they're going to be ready to fight infections. Not only that, the lymph node also shows a capsule. And since I told you they are located in the pad of the lymphatic vessel, they are going to have an efferent lymphatic vessel, which is this one, and afferent lymphatic vessels. Okay. If we keep scrolling down, we can see here again that it shows a cortex, right here, cortex, medulla, germinal centers, very important. Afferent lymphatic vessels, efferent lymphatic vessels, as I mentioned. Okay, we keep scrolling down. Then you can see here the location of most of the lymphatic vessels. We have most of the time in the cervical area, axillary, thoracic, abdominal, in the intestinal area, inguinal area, very important. And the lymph nodes are going to become inflamed, obviously, when there are signs of infections, for example. Okay, so if we keep scrolling down, we have the tonsils. Okay, tonsils, again, they are located in your mouth, and they are basically groups of patches, as it says in here, of lymphatic tissue located at the entry of the pharynx. I think everybody knows where the location of the tonsils are going to be. Right. And there are three main sets of tonsils. You're going to have pharyngeal tonsil, right, which is, they are called a lot of times adenoids, right? They are just at the level of your pharynx. Palatine tonsils, which are on top of your tongue, basically on the upper area of your mouth. And then the lingual tonsils, which are going to be obviously located where your tongue is. Okay, so then we scroll down and we're going to have in there the spleen. The spleen is another very important organ that is part of the lymphatic system. You're looking here, the spleen is right here. Right? The spleen is located in the left hypochondriac area. If you cut the spleen, you can clearly see that it has two main areas. One area is the red pulp, here clearly seen right here, and then you have the other part, which is going to be the white pulp. The reason for that is because the spleen has two main jobs. One of them is related to the red blood cells, and the other one is related to the white blood cells. Okay, the one that is related with the red blood cells, obviously we cover that in the blood chapter, right? So that's why you have a red pulp, and then obviously it's going to have a white pulp because this is the part that is related to immunity. This is the part that is related to the lymphatic system. Okay, so we scroll down right here, and you can see what we just said, that you have two main areas. One of them is going to be the red pulp, and the other one is going to be the white pulp. Right? Obviously, it's very easy to understand the white pulp if you remember the functions of the spleen with respect to the red blood cells. Right? The red blood cells will go to the spleen, and once they try to go through the spleen, if they are old, they're going to get stuck in there, and then the white blood cells, in this case the macrophages, will destroy the red blood cell in order to process the hemoglobin. Obviously, because you have a lot of macrophages as well as other white blood cells in the spleen, then those are the cells that are going to be part of the white pulp. The white pulp has, let's say, serves as a storage of a lot of white blood cells that they are going to be released in the case that there is some metabolic need or some body need, or somebody need in the case of an infection, for example. Okay, so then the spleen is very important for that reason. Also, the spleen, obviously, since most of the blood goes through it and has a whole bunch of capillaries, is highly vascular and is very vulnerable to trauma as well as infection. Trauma usually cannot be fixed because you have so many different capillaries in there that it's very hard to repair all of them. So in that case, they get the spleen and they just cut the splenic area, splenic vein here, and that way they stop the bleeding, therefore saving the person's life.